Hi, my name is Abby Rockers. I'm a 6th semester nursing student, and the time is 5 o'clock on, what day is today? The 29th. November 29th. Okay. And today I will be performing how to do a Foley catheter insertion on a female. So I would start off by walking in the room, making sure I had all my equipment gathered, the Foley kit, my hand hygiene, gloves, pericare equipment. I would check the lighting, make sure it's comfortable for the patient, and the temperature as well. I would walk in and introduce myself. Hi, my name's Abby. I'm going to be your nurse today. We're going to be doing a Foley catheter insertion since you're not able to get out of bed. This is going to be our easiest way to collect urine from you without you having to get up. We'll have a little bag on the side here that will collect your urine. What we're going to do is I'm going to get this, clean everything down, sterilize it, and it's going to be a little rubber catheter tip that's going to go into your urethra, okay? It shouldn't hurt. It'll be a little uncomfortable. It'll feel just kind of different, but if you have any questions about it, let me know, okay? So after I was finished explaining, I would perform hand hygiene, provide privacy, and I would ask the patient if she had any kind of allergies, especially iodine, since we're going to be using that as a sterilization tool. So once I did all of that, check the allergies, I'd also check for the catheter size to see what appropriate size catheter we should be using on this female, and also the appropriate type of catheterization. So we'll be doing an indwelling one today. So I would take this down and place her in proper positioning. So we're going to make sure she's supine with her knees bent, like so. I'm going to keep this on her as long as I can for privacy purposes. I'm going to put on gloves to perform perineal care. I'm just going to clean your perineal area, okay? So I'd be wiping front to back for perineal care. And I'll leave that like so, so it's ready to go for my catheterization. Take my gloves off, perform hand hygiene, and get ready to maintain my sterile field. Alright, so opening this, I'll open open. There we go. I'll open away, 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 and away, and I will note that that outer edge is non-sterile. I'm going to turn it like so, so I have more space to work with. The first thing I will do is take this off and let it unfold. Place it underneath her legs. I can readjust it by not hovering over it, but just touching the outer edge to make sure that it is ready to go. Okay. So next what I'm going to do is I'm going to take these out of the package while still washing my sterile field. And I'm going to don my sterile gloves. First one, I'm going to don my non-dominant hand first. And I'll grab this while keeping my thumb out. I check your thumb out. And I'll keep it above the level that I'm working at right now. So what I'm going to do first is I'm going to bring this down to this field so I can work with it better closer to my patient. Down, place this here, place all my working instruments right here. Okay. So next thing what I'm going to do is I'm going to open the lubrication, so that will be ready to go when I need it. I'm also going to check the bulb according to the whatever establishment I'm at, their policy. Some places require you to check it, others don't. Right now I'm just going to make sure that it's inflating, and it is. So I'm just going to leave that attached so it'll be ready to go. Next what I'm going to do is I'm going to open this iodine packet, and I would place it all over my cotton swabs to make sure they're nice and saturated. Next, put that into my trash can. And then with my non-dominant hand, this will not be sterile anymore, I'm going to open up the labial folds. Like so. Now I would wipe outside. And then get the next one. Go outside. And then straight down the middle. Next, what I'm going to do is lubricate the tip of the catheter 2 inches. And then I will insert it. All right, you're going to take a deep breath out, okay? And I would insert it 2 to 3 inches until I saw urine return. I would see urine return, and then I would go 2 more inches in. I would then inflate the bulb with 10 mils of normal saline, or actually sterile water. And then I would take that off. I would tug on it just to make sure I had a good bulb insertion there, which I do. So then what I will do next, before I touch anything else, I'm going to take these gloves off, perform hand hygiene, and don clean gloves. Next, what I would do is secure this with a securing device. I don't have one now, but it would just clamp in there so it was nice and secure. And I would put this below the level of the patient so it will drain down with natural gravity. And I'll put it on a part of the bed here that is non-movable. Then get all of this out of the way, clean up the work area, throw away the drape, and put patient back in comfortable positioning here. I want to document the date of insertion, the time of insertion, also the catheter size, and the amount, color, consistency of the urine that was collected into the bag. That is all.